I can edit this.
I'm sorry,
People do the same thing over and over, and I'm like, it's not working. You've got to come up with something else, right? Okay, so plantar fasciitis, right?
Yeah.
So think of this as the same scenario, right?
Yeah.
Radial head, radial nerve, extensors, right?
Yeah.
Fibula head, fibula nerve, same thing right here. So most people have pain in the middle of the foot, not on the heel, but everyone's like, oh, it's a gastroc problem. I'm like, it's a posterior tib problem first, okay? Because the pain is here, and the opposition muscle is anterior tib, and it's distal. So it's the same as this, right? This is here, this is here, okay? When this goes down, it twists you around like this, okay? You have a closer agonist, more distal antagonist, and when we go this on the wrist, people pull up with their pinky, right? If you wanted to chest on somebody's anterior tib, you ask them to pull up, right? The very bad plantar fasciitis people will pull with the toe. It's just that toe will pull up because that is not functioning anymore.
She kind of walks like that. I can't really explain.
Yeah, she probably, well, because now she's kind of, this is an underfunctioning tendon, because if you have a dominant agonist posterior tib, it's going to pull you in and around, right? So now you're too long on this nerve, and it's coming down around here, and it's insufficient even on the peroneals. So now you are an inversion, internal kind of directional problem. When that happens, there's no opposition at all. So gastroc is going to pull this heel back a little bit, and you're going to ride high here. It's kind of like this goes down, this side of the hand goes up, okay? Because it's exactly the same scenario. So what you have to do is get the ankle back where it needs to be. Bring this up into an eversion direction, right? Because they're like this. You got to bring them up here. It's kind of like once you get them up there, you can kind of control things. This is why when they wear those straps, they like their foot to be stretched out, right? And now they've created scar tissue in here. So now she's drawing in even more. She's literally suspending on anterior tib, and she has nothing, no activity on that. And that's why the toe is the only thing that's lifting her foot up rather than anterior tib, right? So you can go up here to fibula head and unload that, kind of like the radial head. You can work on this muscle here. You have to activate it. So you have to turn on anterior tib because there's no opposition to posterior tib and gastroc now. So you've got double, and they kind of sit over each other. So you tape gastroc, you're going to get posterior tib, right? But it's like people don't have, they start with pain here, not in the heel, right? So it's like once you kind of get these people back here, that would unload the insertions. That would slacken all the skin, the tendons, the muscles, the limb, right? Here, 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 right? That's where they need to be. And you can ask them to pull up. So pull up to, like, so the exercise would be like this. Yeah, keep it there. Keep it there. You give them a band, you get them to go like this, kind of like an ECU, right? And if you even put them there and ask them to like do this, like straight like this, and then ask them to lift their leg away, they have to turn on this to oppose this because it's just too dominant.
Like
yeah, it's too dominant. And you know, it's not weird if they have this zigzag thing because they'll go like in, out, in, toe, right? It goes like that, okay? This needs to be here. And it might not even be weird because when people are that bad, you know, you gotta fix the medial knee as well. Because now they're on suspension lines. Hinge, 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 hinge. Fix the medial knee. That will slacken things. Bring this back where it needs to be. And then get them to do isometrics with the corrected position. Okay? Stay. Keep it there. Don't let me push it down, push it down, push it down. Good. And when you push this back, it'll feel like it's not moving. Because it's been out of it's like been like this for so long.
Right.
Like you've got to be here. And you can fix it super quickly. Facilitate anterior tib. Correct the ankle position, maybe work on the toe. You can put web cuts right there for the insertion of anterior tib because it's going to be stuck just like ECU is stuck. It doesn't have any contractile ability because their leg is like this. So she will do better with that.
Yeah.
I mean, this is what, if you strapped them, strap and pull this part. Pull that foot of the foot, like wrap it around and pull it back up, like and then get them to do this exercise.
With like a gate belt or with like a
just with a band.
TheraBand.
TheraBand. Okay. But get them like pull it up and then get them to do this, so they're kind of strengthening that whole leg. But their foot is not turning in.
Right.
Yeah. The skin on this outside should go down. So if you had to tape it, you could tape it here up to here. That'll help glide the nerve out of that crease too. And then this goes this way to this way. So it's kind of like this starts here to here, here to here.
And
Because there's a
you're
fascial
doing like a
line.
posterior glide on the fibular head?
Generally a posterior glide, but sometimes, you know, people's legs will sit like this.
Yeah.
So you'll be like, let me get you here.
Okay.
Okay.
Yeah, kind of like that.
Like
and get
almost
you.
like a medial rotation.
Yeah,
Okay.
because it's kind of like what we would do here is like,
Yeah.
let's get you here.
Here.
So
Yeah.
it's kind of like, let's kind of get all your pieces back together because they're suspending over here.
Right.
So,
Okay.
so now you have a video so you can go back and analyze her foot and give it to the PTs and work on this, collaborate on this, because this will be the scenario. It's the crazy part is it's identical to this.
Yeah.
The arm, and this is what I think I love about being a whole body taping instructor. Like, I wouldn't work this out if I didn't also do this and see the same patterns. I'm like, they're the same, but nobody's looking at the patterns as the same. They look at separate.
Yeah.
The leg is just easier because you see it front on. The arm is more difficult because it rotates more, but it's the same. So
Okay.
that's good. Now you got that.
Cool.
Thank you.
We'll send it to you.
Yeah.